I just realized something makes me smile because it has been so long. So, you know, perhaps already that I had this turbinate reduction. My lower turbinates completely removed. The mucosa was cut, and I suffer from a form. A form. It seems there are two forms of ENS. One that makes you, both forms do cause dry nostrils, but one which is more common, I think, it's making people feel they are getting too much air inside their nostrils and they feel like they are suffocating, anxiety, and so on. My form has been like this, just like that, for the first month after the surgery, but after that, I started actually, my nostrils were still very dry, but I started having nostrils, I would say 90%, 90 so percent block at nighttime during sleep. And my problem at that point was that I would sleep with my mouth closed. I could not keep my mouth open. And I would wake up in the night, and this is just, I don't want to put words on this. I, and hopefully, I'm the only one on the planet who was suffering from this, to feel and sleep with perhaps 10% of air getting into your lungs, 10% from the air that a normal person is breathing in, right? So 10% is like, imagine one of those straws, oftentimes that you stir coffee. Those, I think they are kind of dark brown, black, tiny straws. Imagine trying to breathe through those straws for the whole night. So don't stop there. Don't imagine that, please. Anyhow, all this to say that so that was my outcome. But I made this video, and by the way, if you wonder, the way I sleep now, I do breath. So I do mention in other videos that I started a diet. So all this, the surgery had happened somewhere, I believe, in 2009, if my memory is good. I don't really have the precise date. But since about 2020, somewhere around 2021, for perhaps a couple of years ago, I started doing a diet, and I explained in another video, which I put on Rumble, no longer on YouTube, why this diet was really, really my relief for this issue. I don't want to just talk all that matter again. It's in a video. Just check my channel, my playlist, and the link for Rumble. So I do have now a diet and eating hours, and this because the digestion actually is related to the nostril dryness and also blockage. If it happens, I explained this in another video, but this is only on persons with ENS. On healthy person, they don't really have an impact from digestion and what they eat, right? So anyhow, all this to say that right now I'm sleeping with my mouth against the pillow, so I sleep on the side. This is something I don't think I mentioned in my videos. I do sleep with the mouth somehow on the side, so either side of the either cheek, and I keep my mouth on the side against the pillow. Basically, the pillow stays like this, and this way I can just kind of hold my mouth open for the entire night. And obviously I do switch size, and I also had to make, because of this position, the pillow was sitting against my eye sockets, and then I started having a problem with pressure in my eyes during the day. So I had to actually make a pillow. Also, I put this video, that video, I think it's on the NS playlist. Actually, I have a pillow, a flat pillow from a foam, which I cut some areas to have the eye sitting in a open loop inside that pillow. Anyhow, that's another story too. But all this to say, right now I sleep with my mouth. I breathe at night when I sleep. I have to breathe both with my mouth and with my nose. Both of them I breathe. For instance, if I eat something late or the wrong foods, my nostrils get blocked and I cannot sleep then. So I have to use both mouth and nostrils. Anyhow, all this, sorry, that's just my fault. I apologize. I think it's 5 minutes. I wanted actually to say something else in this video. So I did actually realize just now, it's 2025. I didn't realize it at that point. What happened to me, why I got into the ENS surgery. First is many years ago when I was young. I had an accident. I was riding my bicycle. I didn't watch forward. I was listening actually. There was a chain a noise or something like this, and I was riding by the side of the street, and there was a car parked. Well, obviously, I just was too young to think, and that car actually was a truck, and it had a flat window at the rear. So I didn't have helmet. Perhaps it was better because with a helmet, maybe I would have broken that glass and cut my face. Or I didn't have a helmet, and I did smash the window of that truck, the rear window. The car was parked face first like this, and I broke my nose. I had my injury to my lips. Anyhow, and I that was my big mistake because they brought me to hospital, and the doctor noticed my nose was swollen. He figured out must be broken, but they don't fix the nose. They don't put the bones back right away. Why? Because there is a swelling. So the doctor told me at that point, come back 1 week later. Now, he didn't say why. I mean, you study so many years, you do those medical studies. It's so long, so difficult, so intense. Why don't you just learn to explain when you say something to a person? Just say why. Why? He didn't tell me why. I had no idea about what a broken nose could be and that it has to be fixed within 1 week or about 10 days, 1 week. And yes, I was saying that when I left the hospital, I was still a lot of swelling. I do have pics. And then it happened that I had tickets to go to Cuba in holiday. So I went to Cuba. That was 1 or 2 weeks, and during the trip, my swelling did regress. And I can tell you, I had no idea my nose was broken. I do show this in a video how to check your nose for broken. So I thought to myself, well, why would I come back to the hospital? Because my swelling is gone. So, since that moment, that accident, I had my nose broken for many years. I think, don't know how many, maybe 10 years or so. And what happened then is that my nose shifted so to one side, my bones here, there are very small passages on either side inside the nostrils. So if your bones are shifting to one side, usually there is a displacement here, but also possible at the tip as well. So this is a bone here, and then there is a cartilage. And make sure you never try to push on this cartilage because it causes hematoma inside the nostrils, and then it blocks your nostrils. So this is really bad. So never try to do something with your nose by yourself, believe me. So all this to say that my nose was broken, and from that moment on, when I think back, I stopped sleeping well. I mean, I was sleeping well, but I will no longer having nice dreams and stuff. The sleep was no longer very resting for me. I could still breathe through one side of the nostril, the one. So imagine the nose shifts to one side will remain open, actually wider open, the other side will get blocked. And also, I'm just putting this in this video, um, there are sinuses, frontal sinuses, there is a sinus in the cheek. These sinuses have drain holes, you may read online, inside the nostrils. They drain, they have small opening inside the nostrils. And when the nose is shifting to one side, it's possible that some of those holes get blocked, just like a door, and they should stay open. And that will cause those sinuses to get infected and cause secretions inside the nose. So there's really other side effects. And also in small kids, if sinuses get blocked like this and infected, that causes otitis, and that may also cause a problem. I'm not sure. I think it's related to asthma as well. So look up on internet for yourself. Anyhow, all this to say that for several years after the accident, I was still breathing with one side of my nostril. And then something I didn't say in videos. One day I noticed my nose was shifted to one side. Actually, it was more shifted than this. It was like this. So it was my mistake. I thought to myself, if I push in my nose, I'm going to replace it. It was foolishness, right? Mistake. What happened when I started pushing in my nose is the nostril that was still open got a hematoma inside. That was a hematoma on the septum, on the one side of the septum. Hematoma means there is blood accumulating. The septum has a small skin, if you want, on it, a small mucosa, a small membrane, and I got blood accumulating underneath that membrane during the nighttime when I was laying down and sleeping, and that blood will accumulate and will block the remaining, the nostril that was still open after my nose has been broken. So I had still an open nostril, and that one started to get blocked by this hematoma, blood accumulating on a side of the septum. That's why I went and I started to basically take appointments to visit a specialist, a ENT a doctor, because when I got this hematoma in the remaining nostril that was still open, I could no longer breathe by night. This is before the turbinate surgery, right? So just to put it in time. At that moment, after this hematoma happened, I could no longer breathe by night. That's also the moment when I did a burnout. I was working as an engineer in front of computer, so it was an office work, and I could no longer do that work. It was that period was ah okay. It was like this, right? I just don't want to remember those feelings. Yes, I was saying I was working as an engineer, and at one point, because of my night sleep was destroyed by impossibility of breathing through the nose. At one point, I remember I was sitting on my computer. I was reading a line, not something technical or complicated, just a line on a report or something like this. I would read a line, really, just a sentence. At the end of the sentence, I would not remember what the sentence was. That's how destroyed my intellectual ability was, because my nights were destroyed by problem breathing through my nose. These are things I never said before. So at that moment, actually, I quit that job. I was actually put on health leave or something like this, because it was impossible to continue. And I started looking for a ENT doctor to help me to actually, I knew it's just a hematoma on the septum, so I was thinking a doctor would just drain this hematoma and just help me start breathing again through that nostril that was still open after the accident with the bicycle. I started looking for a doctor. Now let me tell you something. I don't know. It's just I did apologize once, but I'm not. That's just how these videos go. Sorry about this. I wanted to tell you the subject of the video at the beginning, and now I see I'm 15, perhaps 20 minutes into it. But at least perhaps that gives you some tips. So here in Canada, in Quebec, I live in Montreal. I was also in Montreal at that time. It takes a long time to get an appointment to an ENT specialist for some reason. So I remember the appointment was in somewhere in between 3 and 6 months, imagine. And I could not breathe by night at that point, and my sleep was destroyed. So imagine that long wait. Um, so I took appointment to three ENT doctors. Actually, there was a fourth one. I was going with my little daughter, which had an otitis, and she also had a broken nose in her very young childhood. So anyhow, I did took appointment for myself at three specialist ENT doctors. First one, I enter. So imagine this is an appointment that I wait for it 3 to 6 months back then. I don't remember for each one how long. So I enter the office. This is a man, rather age, like 56 years old. And I told him, listen, I have something I describe. I do very precisely describe this. There is a hematoma that's inflating when I lay down in my bed and stuff. First off, what they do when you enter their office, they have this spray, which is very bitter tasting, if you want. They spray inside your nostrils, and that really shrinks everything inside, and it's really clearing the nostrils really, really strongly. And they use that to examine you, but at the same time, that was taking that problem of mine away. So actually, they did not believe me when I was saying that I have hematoma inside my nostrils. But listen to this. This is really fun, so to speak. So this doctor, the first one, I enter the office. He put that spray. He waits a few minutes for the nostrils to just kind of shrink, not shrink, but expand, if you want. It just get clear. He looks inside my nostrils, and he sits in front of me, and he tells me this. I don't know why. It's not writing on my forehead. I say this in other videos. I'm Christian. I live Christian life. I go to church. He says to me, "You take drugs." Then I was like, imagine several months into waiting for this appointment in terrifying, terrible suffering, and he's the only hope. Let me tell you this. You've seen my videos, you've seen all the things that I tried to discover by myself. But at that point, that was the beginning, or just before the beginning of my ENS condition, before the surgery. And I hear the person, when I was going to a doctor, I was going like to God somehow. I was having this in my mind. This is the only person that could help me. That was very clear in my mind. And that person tells me, you take drugs. I say, no. And then, trust me, this is exactly what he said. He repeated this. He said, no, you are sniffing drugs with your nostrils. That's why you have a problem with your nostrils. I don't exactly remember what my reply was to this. I think I said no. And then he said, okay, goodbye. Um, I don't know how to describe that moment. I just feel like laughing, but you can tell, I don't think at that moment I was laughing in any kind of way or shape. Yeah. And this actually, why I'm mentioning this, this is not, listen to the following ones. This is just the first guy. Okay. We are in Montreal. Okay. It's supposed to be, it's like G20 or G7 country, right? It's not some place in, I don't want to insult any country here, but it's not somewhere in Antarctica or something like this, right? Some random weird place. That's when I learned what doctors are actually, at least in Canada, because I can tell you, I came from Romania and I don't want to brag about that country, but, and I know there are crooked doctors, and not just doctors, politicians, many more. But I can tell you in Romania, at least in my country when I was living back then, I know there were doctors that were doing this profession with passion, with dedication, with seriosity, professionally, really good persons. In Canada, I did meet, actually, I did also work. I did study in engineering. I did study a master degree. I actually did work with doctors, with surgeons. I was in surgery room for another matter, not for nose, but for something else. And I did meet really, really nice doctors here. But you need to understand that many doctors here in Canada are pure businessmen. I repeat this, I could not repeat this more. They absolutely go to study medicine for the money. Trust me when I say this. They are capable of studying this, that's one thing. But that the reason why they are doing this, many of them. And that explains their reaction, their attitude. Okay, and also, mind you, many of my viewers are in United States, and I know in United States you can sue. You have a lot of lawyers and stuff like this in companies. Canada, just imagine exactly the opposite. I say sometimes in Canada you need to die 2 or 3 times from a doctor mistake to be able to sue. That's welcome to socialist Canada or whatever it is. Anyhow, all this to say that that was the guy answered to me at that moment. Imagine my shock, and also, like I said, it was a terrifying suffering that day. And I took appointment to another doctor. What do you think is going to happen? I entered the office several months later of not sleeping at night. Entered the office, sit on a chair. I think this one also put that spray, and if I remember well, he left the office. He had to wait a few minutes after the spray. Comes back, looks inside my nostrils, and says just that. You have absolutely no problem. Okay, and let's just keep going. By the way, by the way, I'm just I know your reaction of many of you when you watch this. Why? Because several persons, and I think there are much more than this, have had the same experience. But actually, I'm not sure if it's after the surgery or before the surgery, but no, I don't remember exactly. But I know there have been several comments saying that doctors really misinformed them, or no, yes, this is it. So several persons commented on my videos that once they got ENS, they went to doctors and told them, I suffer like this and like this from this condition, and the doctors told them a truckload of lies. Either, oh, it's all in your mind, you have psychological problems, it's not true, it's not possible, blah 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 blah. So I know many of you are relating to me to this video. Anyhow, so this doctor, the second one, tells me, you have no problem. It was really quick, really. I mean, he didn't explain or detail or nothing. You have no problem. Yeah, he said like this, and he left. I mean, he was still in the room, but he went somewhere away from me. I don't know, behind me. I left. I stood off that chair. I did exit the room. I closed the door. I did a few steps, and then I started to shake. I was like in shock. So I came back. I'd open the door. I enter again the room and stand in front of him. And I told him, I don't exactly remember the words, but I say something. Look at my nose. My nose is broken. I have a problem breathing. He looked again. He said again, no, there is no problem. Um, that's when I left that place. I took another appointment, and this third appointment, a different doctor, a third doctor, happened to be a Romanian. And I think this is why he actually, you will see what happened. I explained to him, so after several months again of waiting, I met this guy, put his spray, the same story, there is nothing in there. And I explained to him, listen, I just cannot, you are the third one. I just cannot sleep and breathe at night. And it's really, I did explain to him very clearly, especially I do speak French good, but he was a Romanian. I kind of had a more clear contact to him and explained to him really how it happens, that hematoma problem at night. He didn't believe me. And not that day, but then I understood later on that a doctor is not what we imagine. Professionally, they may be good. They may know what they are doing or what to do or and how to do it professionally. Humanly, as a person, they are just regular persons. I mean, regular. They are just citizens, right? You will have individuals who absolutely don't trust another person. You will have individuals who never listen to other person, never believe other persons. If, for instance, they have already an idea in their mind and someone else is saying something different, they will absolutely don't believe that person. Believe me when I say this. I don't want to explain why. I knew a doctor actually very well, and I could see that person, the personality. I'm not saying it's all the same, but I can tell you that if you want just my take, generally speaking, not generalizing, not everyone, but generally speaking, to me, a doctor is someone quite stubborn. And yeah, I think that's pretty much the best attribute that I would put to a doctor. Quite stubborn. All this to say, he did not believe me. And had he believed me, I think I wouldn't be doing these videos today. He would have fixed the problem correctly and the actual problem. And when I insisted, because I knew this was the third guy, I will have to wait another 6 months to see another one with who knows what result. I insisted, and then he said, I'm shaking, making this video. And then he said, okay, I'm going to do something. I don't think he said turbinate or something like this. From what I remember, at that moment, I didn't even know what turbinate is anyway. Um, from what I remember, he said something like, I'm going to do something that will open the air passage inside your nostrils. That was it. He didn't say something like, it may have side effects, there is a small risk, there is anything, or I'm doing this, I'm removing this piece, cutting this, I'm going to do this procedure. Myself, I was just so desperate. When I heard that, I said, wow, he's going to fix me. Even if he didn't say he's going to address the actual problem that I was explaining to him. So I went to surgery and he chopped my lower turbinates again completely. He cut through the mucosa. He destroyed the mucosa, which caused it to become dry. And after the surgery, I went through all the hell. And by the way, the day would, yes, the 4 days after the surgery, I had patches inside the nostrils, like big patches of, I know, like sterile material that would stay in there for 4 nights, 4 days to kind of heal the cuts that he did. And at that point, I was into this terrible sleep problem because, like I said, because of before the surgery, because of that hematoma for more than 1 year. And after the surgery, I had to keep those patches 4 days, both nostrils, and 4 nights. 4 nights. So after more than 1 year of brutal, if you want, bad sleep disorder, I had to 4 nights sit in a on a couch. I could not lay down. Why? Because the surgery has been complete full anesthesia. And when they do anesthesia, they intubate you. They put that just like you see in the hospitals. They put that tube inside your mouth. You are asleep, if you want. You have anesthesia, and then when you are asleep, they put that tube inside your mouth and inside your lungs to breathe. So you are connected to a machine that's actually pushing air inside you, right? That's how it works during the anesthesia. And then he was doing the surgery at the nose. Because of that tube got into your, obviously into your throat, then just into the trachea. I guess the persons who insert that tube is really oftentimes very difficult to insert. So it takes someone very not just skilled but kind of talent, if you want. And oftentimes this is not done by the doctor; it's done by nurses, and they don't care, or many of them are just not really good at it. And that tube is like a thick plastic tube that really gets into your throat, and my throat was very irritated after the surgery when I wake up for several days. So when I was trying to sleep at night, what happened is there is this, I don't know what's the name in English, the thing that hangs in the back of your mouth, right? Is the thing where you swallow. There's like something from the top down. I don't know what's the name in English. That thing was really swollen, and when I was falling asleep, I could not breathe by my mouth at all. My throat was just blocked, was blocking because of that irritation, because the intubation plastic tube. So I could not breathe by my mouth. I could not breathe by my nose either because I had the patches inside the nose. 4 nights. I slept on a couch. I could not breathe by my mouth because of the throat inflammation if I would lay down in bed. So I had to sit basically on a couch and try to sleep 4 nights like this, breathing through my mouth. But that breathing was really, like I said, on and off. 4 nights like this after a period of more than 1 year of severe sleep problem. Those 4 nights were just, I can only describe that as hell. There is no, I think hell is going to be worse than this, but for this life, that was hell. 4 nights. I still remember those 4 nights. I just better don't describe it otherwise. And then, well, the fourth day, I don't remember. I went to back to the doctor. He removed my patches, and the first hours was amazing. The breathing through the nose was just great, and this is what pretty much everyone is describing. But then the next days, I started to have this feeling that I get too much air inside the nostrils, and then I started to try to put things inside my nostrils to kind of get less air, and so on and so on. And then is the rest of the history. One thing that I may have done wrong at that moment is he told me after the surgery to use irrigate my nostrils. He gave me there is bottles in the drugstores. It's not really saline water. It's similar, but not exactly that. And I did so, but not for long. Maybe I should have done for longer and more often during the day. Maybe that was one of the mistakes. Who knows? Maybe because I didn't do that, my my mucosa did stay dry. Maybe I got all this problem, ENS, with dry mucosa and blocked nostrils after the surgery because I didn't do that irrigation. So if you are preparing for surgery for some reason, be really careful what kind of technique you do. Like I say in other videos, but be sure you do that irrigation several times a day, and I would say several months. Maybe, who knows, maybe one day we will find out that's the reason why people get ENS. I don't know. Maybe you tell me in the comment section if you did that irrigation properly several times a day for a long time, several months, and you still got ENS. Just let us know. But be sure to do it. And by the way, if someone is looking at this video because he wants to choose to do this turbinate reduction surgery or not, be sure what technique you do. Most techniques are damaging and a risk, including radio frequency is not good. That's what other people are reporting in my comments. The perhaps less damaging is really something that doesn't cut along the mucosa. Do not destroy your mucosa and don't remove the entire lower turbinates. Always, I would say, no more than 30% or so. Don't let the doctor get with his lawnmower into your nostrils. Again, I repeat this, these doctors, you think they must be the most empathic people in the world? I think you got the answer, right? Trust me on this one. I'm not blaming them. I'm not accusing them. That's not the point here. I just tell you the truth. And you judge by yourself then afterwards and take your own decision. They are not empathic, these doctors. Trust me. I know there are empathic doctors out there. I've met them. I think I've met them actually. I'm absolutely convinced there are empathic doctors. I'm just saying that many of them, or you want, maybe most of them, at least in these developed countries, they are not empathic. They are just the opposite, actually, right? Businessmen think like that way and take your own decision. I was saying that yes, don't let them butcher because they really just say, okay, let me do the maximum for this person, right? For this uh, for you basically. Let me just remove everything and I'm going to do it just once. I'm going to get the maximum results. That's absolutely the wrong approach. And the second thing, do touch only one nostrils. Don't try to touch the other nostrils because oftentimes your problem with breathing with your nose is caused by a broken nose. A shifted septum does not shift by itself. You are not getting born with a shifted septum. That's a lie. Shifted septum means, I don't know, statistic or something like this, at least 90% of the time, broken nose. And let me just continue my story now because I was at the third doctor who did the surgery. You do remember they were rejecting me, all three of them, and actually there was a fourth one who laughed on my face. So after the surgery, I went to all the struggle that you already know, and at some point, I don't remember which was the first one, but I do remember perhaps is this one the first one. At one night, I was suffering so much. This is after the turbinate reduction, so this is already the period of empty-nose syndrome, right? Suffering. So I was suffering so much at the night. I went to the ER emergency room at 3 a.m. or something like this. I had to wait 2-3 hours. That's how it goes in Montreal. And the doctor, obviously, she didn't know it was a lady. And she told me, so I told her why I'm there suffering after that surgery, but I didn't say the word surgery. And so I told her, look, I just cannot sleep. It's breathing. I don't know. Perhaps at that point, my nostrils were blocked after the surgery. I don't remember exactly the stage. But at some point, I told her I had a surgery at my nose. I think it was 6 months ago. The second this is the ER person, right? Not a specialist again, just a doctor at the hospital. The second she heard I had surgery, she told me, Oh, you had heart surgery? Oh, just go back to the doctor. It was a lady doctor. Those very empathic persons. Just go back to the doctor. And by the way, she had a younger student. They do this. I'm not sure what's the name in English. Just study. When you study medicine, at some point you will go in hospitals and work in hospital as well, along a an adult doctor, right? And that person, the young person, so there was two ladies in the room, a young one and a student doctor and the real doctor. The real doctor told me the moment she said she heard the surgery, there was a surgery, she said, no, go back to the surgery. So I'm here in front of you with the suffering. I came here at 3 a.m. and she just kicked me out of there. Um, how to say this? Be prepared for this, right? But the other doctor, the young student, she was there. I do remember her face when the adult doctor, the real doctor, if you want, kicked me out of there. I do remember the shock on the face of the young girl, student girl doctor who was there. She was just like, wow, wow. But obviously, she wasn't the one that was in decision. There it was the other doctor. But I'm just sharing with you these stories. So this is real world. Anyhow, all this to say, I had to take another appointment to the doctor who did the surgery. I came back to that room. He put me down. He put the sprays. I explained to him that right after the surgery, after the first week or so, I started having problems, feeling too much breathing too much air, nostrils getting dry, stuff. And if my memory is good, I just want to be honest with you, and not say imaginary thing. If my memory is good, is this moment, at this moment when, so this is the doctor who chopped me, right? Is that this moment when he said, I think he is the one who said this. Actually, no, you don't have problems. You have, I think he said something like this, you have psychological problems. I don't think he said it's just in your mind. I think he said something psychological problems. You are something depressed or something like this, if my memory is good. This is the doctor that operated me, that did the surgery, operation, and now he's kicking me out as well, right? Is it something new for you people? I know some of you are going to just say, what? The same thing happened to me too. That's to you, not to me. So I'm sure for many of you, this is not new news in any ways. So yes, he kicked me out. And then from that moment, I think more or less at that moment, I realized I'm by myself. The doctor, no, thank you. He doesn't like me. Yes, from that moment, I started suffering. Basically, the diet came later, much later in life, many years later. But um, there is this moment when I visited Romania once, later, a few years later. And I met someone in Romania who was also a doctor in my family. And he said, oh, I know some. I explained to him the problem. At that moment, I didn't really knew what was happening. So this is also back in time. It's hard to, uh, I think it's somewhere perhaps in 2012, 13 or something like this. There was no much internet. I had no idea about the empty nose syndrome or something like this. So I explained to him the entire suffering after the surgery. And he said, I know an ENT doctor in Romania here, a lady. And she's not the chief, something, she's well known or something like that. Maybe that was only blah, blah. And he actually contacted her and arranged an appointment because I had no rights to be examined in Romania. I still have Romanian citizenship. I don't think I had the right to go in the hospital. But anyhow, I went to that hospital. Let me just tell you that funny day was after the program. Things like this happen in Romania, right? It's not really perfect. So I went under the program after the program, an evening, and this lady was in that room, examination room. She had the camera. She looked inside the nose, and that's actually when I learned that my lower turbinates have been completely removed. I could see it on the camera; it was gone, both sides. These are the big ones, right? The lower are the big ones. And so this lady had students as well with her. And I remember well, it was all ladies for some reason. So this is the main doctor, the lady, and there were 4 or 5 lady students, all aligned, very cool, very nice looking. Um, I'm not saying they were good looking, just nice, like kind of kids, no, just like students, basically. They were just sitting, I think they were sitting on a desk or something like this on the side of the room. Very funny. She looks inside the notes, then she takes a chair, sits in front of me. I was sitting on a chair myself. I think the students were on the side or behind her. I don't remember exactly. She looks straight to my face. She's close by, right? And she says this, plus minus commas, a few two words, but it's almost the same sentence. She says in Romania, you know, so you understand why I came there, right? I explained the surgery and the suffering and the breathing at night and stuff. This is what she says in front of me. You know, your nose, the nose, not the nostril, the nose, right? The shape. Your nose looks good. You don't need a plastic surgery. You look good already. I think this is perhaps one of the points when you learn something about other people. I've been living my life, just maybe that was just me, or who knows. Um, I don't know, not really knowing other people, how they really are. I'm not saying this was a mean person. What I understand from what she said is one, so remember, this is like someone from my family who contacted her, right? One, she does not believe what I say, my suffering. I'm talking here about suffering, not the color of my kind of wearing off hair, which is no longer more or less there. So I'm not talking about dressing, cars, politics, forests. I'm describing her many years of suffering and the surgery. And I just wish she was here to listen to this. She just doesn't believe it. As simple as that, a doctor. First off, lady, just my message for you, and it's not an angry message. You actually thought I'm lying. You thought I'm a liar, right? That's what you thought. I'm a liar. I can tell you, lady, you are sick to believe, just like that, for no reason, that someone just comes in front of you and lies. So perhaps you think many people are just like that, right? How can a person just think that easily that someone is lying? Second thing, she didn't believe at all the idea of suffering, and actually she said two things at the same time. First, she I don't know. I'm not saying she admitted. She actually confessed somehow that she noticed my nose was broken, and at least from my memory, I don't remember telling her. Maybe I did say my nose was broken. I just don't remember that part. So let's just skip this part. So she thought at that moment that the reason I was there was for a plastic surgery, and I was perhaps, I did ask someone, a relative, to contact her with a lie. So I just basically cheat on the system, on the Romanian system. I would have cheated anyway. That's my fault, if you want, legally speaking, if she would have helped me in any way. But she thought I was just trying to cheat the system with a lie to get a nose job. If you don't know what a nose job, just look online. It's just like plastic surgery, basically. So that was her thinking. I don't know. I think it would have been so much easier for me to talk to the relative and just tell him, hey, do you know someone who can do a plastic surgery? I just pay cash or something like this and just give me a plastic. Why didn't she just thought that anyone else would just say, I just want a plastic surgery? I mean, I don't get it. I just don't get it. So it's just, why was she thinking I would hide this from her, right? I don't know. Maybe she had an idea. Anyhow, all this to say that she says that in front of me and in front of those students. I don't think I had an answer at that point. I don't think I did answer. Maybe I said, no, it's not true or something like this. I don't know. But I left at that moment. I didn't start to argue with her. She wasn't the first person doing this, the same thing, basically. I don't know. But you also notice there is a denial here, right? The same denial as the one who did the surgery. Um, the one at the emergency room, I don't blame the person because she wasn't a specialist. So there's again a denial here of the actual suffering situation or condition. And many of them, I think they don't know. And by the way, maybe you wonder, I think in the medical schools, this empty nose syndrome condition is just not presented to the students, is not in the books. So perhaps they just either don't know about it or deny it, or the third possibility is simply, and this is the sad truth, there is nothing they can do about it. More or less, there are a few options, some more or less um, useful, such as implants, and I also heard about stem cell treatment, which I don't think it's, I don't know, my guess is just there is a chance to be a scam if you want, and it's also extraordinarily expensive, very expensive. So there's also this implant treatment, which it will perhaps recreate the more or less, is not perfect, the airflow inside the nostrils, but I don't think, or I don't see how would cause the mucosa to become wet again, right? So I don't think it will help the mucosa itself, just the airflow restriction, the natural one. So anyhow, all this to say that yes, it's true, they have nothing, they cannot do anything for you at that moment. So perhaps they just either, I don't know, either choose to kind of blame you, tell you have psychological problems, or you just want a nose job, or you want to cheat and just have a surgery, like plastic surgery for you to get to make yourself more beautiful, or maybe you have a broken nose and you don't like this and you cheat on them and just try to get the nose fixed, reshaped to look better. I don't know. It's just is weird a bit. But again, I think at this point you are getting into the mind of a doctor, right? So I'm convinced if that doctor was my mother, she would have believed me. But when he's a stranger, I don't think they care I don't know, they don't trust you, they don't care. And perhaps in some way, the truth is that it's so easy for a doctor to just say something like, you don't have a problem. It's not true what you say, you know? I don't know how it's in the United States. Can you sue a doctor for this? I don't know. But at the same time, I think when you enter an office like this and you have, like it was my situation before the surgery, right? Sorry, I'm jumping a bit in time like this. So when I was getting in offices before the surgery and I was telling those doctors I had an accident with a bicycle and I broke my nose, they were always saying, no, your nose is not broken. Your nose is great. The second one, also I told him, I'm not sure if I said this in video, the second one, doctor before the surgery, the second doctor that I did had an appointment with, I told him my nose is broken, and he said no, it's not. And I know now, I'm fairly sure he was lying. He was lying. Obviously, it's so easy to. It's like argument with your wife, right? Yes, it's like this. No, it's not like that. It's really just he's the one with the tools, right? He's the one with power, and he just kicks you out like this. No, you're not right. It's false. It's not true. It's so easy for them to say so, but I think they know. I mean, a doctor, a ENT doctor, when you have a broken nose, I think he knows the right away. He sees the nose is broken right away, and I showed this in another video, and it's not easy for us to realize this, but for them, that displacement must be very visible because this is basically their job, right? Their studies. So they must be very used to it. But like I said in other videos, when you enter an office for one of these doctors and you tell them before having a turbinate surgery, right? If you have a broken nose and you tell them, I cannot breathe properly by my nose because it's broken, or maybe you don't know if it's broken, they most likely won't tell you the nose is broken, the bones of the nose, and most likely will not tell you that if, and this is a point in another video, before you do any turbinate surgery, if your nose is broken, by all means, find I'm not sure, a plastic surgery doctor, not an ENT doctor, a plastic surgery doctor, and ask that doctor, is my nose broken? Can you look inside my nose? Are the passages on both sides properly sized, normally sized? Because when your nose again it shift to one side will be more closed, and the other ones also may grow more close because of mucosa growth if the nose damage has been done in the childhood. I say this in another video. Ask me in the comments. It's too many ideas to talk in a single video. But if you cannot breathe properly by your nose, before thinking of doing any kind of septoplasty or turbinate reduction surgery, go to a plastic surgeon, the ones that shape the noses for celebrities, for people with money. Go to an office for these doctors and ask them to check inside the nose, the air passages, and to check the shape of the nose to make sure it's not broken. Because if the nose is broken, don't do any septoplasty or turbinectomy. Don't touch that. What you want to do is a nose job surgery, a nose bone reshaping, repositioning. That's the correct surgery. And that surgery should not affect your turbinates and should not give you empty nose syndrome. At least ask the doctors that do nose jobs, how they call it, ask them if they are going to touch the mucosa or the turbinates and say no, refuse to touch the mucosa. Tell them touch only the bones of the nose, the bridge, if you want, the upper bones of the nose. Don't touch turbinates and mucosa inside the nose. So that's actually the real fix, like I say in another video, for people who have trouble breathing and had a broken nose. What these doctors, the other doctors, the ENT ones, hopefully I'm not too confusing here. So what the ENT doctors that do turbinate reduction do is they do sort of a cheating, and instead of reshaping correctly the nose, they just empty your nose and destroy your anatomy and possibly your health. So don't believe those ENT doctors saying, "Why? No, don't go, don't do a big surgery to reshape, big expensive surgery to reshape your nose. Don't do that. I'm going to do something quick inside your nostrils, remove something, and it's going to be fine." Don't believe those doctors. They make money out of it. They don't care about your health. They don't care about maybe destroying the rest of your life, affecting you for the rest of your life. They don't care about that. They just do their job basically. Don't believe them. If your nose is broken, reshape your nose. Don't touch inside the nose, okay? Um, yes, that was my idea about this video today. I'm really tired. It's 1 hour into it, very long. Hopefully you did watch this as a story if you want, so to speak. And yeah, best wishes, and check in the comment section, maybe ask any questions, and just check my other videos in the playlist of NP Nursing. Thanks for watching.